by definition, is artificial restoration that rebuilds destroyed tooth parts or extracted teeth, atrophied alveolar process, defects of maxilla and mandible with additional reconstruction of defective oral cavity function. So restoration or improvement of chewing ability and distorted articulation. Dentures, thanks to the correct shape, can protect the oral cavity against various deformities, teeth migration, occlusal disturbances, or vertical relation. It can also inhibit process of alveolar atrophy or development of periodontal disease. So it could also work as a prevention. Now a few words about classification. So we can classificate by a way of fixation in the oral cavity. And here we have fixed dentures and removable dentures. So first group are permanently fixed in the oral cavity, rebuilding tooth tissues like veneers, dowels, crowns, bridges. They can be removed only by a dentist. In second group, removable denture, the process of putting and removing is done by patients. Depending on the number of missing teeth, we have partial or complete denture. Now, classification by a way of transmitting chewing forces into the supporting tissue. So, we can choose tooth-supported prosthesis, tissue-supported prosthesis, and tooth and tissue-supported prosthesis. First group, transmitting forces, chewing forces, onto the alveolar process by the teeth and the periodontum. So we have fixed dentures like crowns, bridges, some removable dentures, especially skeleton denture. Second group, setting removable dentures, transmitting chewing forces onto the underlying bone by the mucous membrane, the oral submucosa, and the periosteum. So we have acrylic partial dentures or complete dentures. And tooth and tissue-supported prosthesis, transmitting chewing forces onto the bone base, also by the periodontum and the oral mucosa, like overdenture or some sort of skeleton dentures. Classification by a time of using it. First group is short-lasting dentures and second long-lasting. Short-lasting, in another word, temporary. So we have short time of using, several months usually. Then they are replaced with a final dentures like temporary crowns and bridges, splints, immediate denture, overdenture, as a stage in TMJ disorders treatment, for example. And the second group, long-lasting dentures, so we have long time of using, usually many years. And fixed denture we can divide also extracoronal, intracoronal, or dowel. So intracoronal are usually inlay, onlay, overlay, pinlay, etc. So it's only in the crown, or extracoronal, right, like crown, bridge, veneer, and of course dowel, post, and core. I'm sorry. Yeah, the first group, post and core. So it contains post part and core part. So on the picture on the left and on the top you can see a tooth distracted by caries, endodontically treated, and we can try to restore it using post and core, and then on it a crown. Yeah, so many examples of post and core. We have individual, we have standard one, so many types. Second group is dental crown. So it's an artificial replacement for the covering of the tooth. And of course, again, we have many types of it. we have all metal crown. PFM means porcelain fused metal crown, like on the top, and all ceramic crown when we have only ceramic part. Of course, all ceramic are the most aesthetic, and PFM also is aesthetic, but we have metal underlying, so not so as full ceramic. And all metal in nowadays are not usually used, sometimes in a back lower molar maybe, or sometimes in children's mouth when we have deciduous tooth. So dental crown is cemented. It's an uncemented extracorneal restoration that covers or veneers the outer surface of the clinical crown. The primary function of the crown is to protect the underlying tooth structure and restore the function, form, and aesthetic. Next example of fixed denture is dental bridge. So a fixed partial denture is defined as partial denture that is cemented to the natural tooth or roots, which furnish the primary support to the prosthesis. A fixed prosthesis is defined as a restoration or replacement, which is attached by a cementing medium to natural teeth, roots, implants. These dentures are often termed as bridges. Yes, and here we have a scheme. So we have a dentulous ridge next to abutment tooth or teeth, and we have retainer, which is cemented on abutment, and between them pontic connected by connector to the retainer part. And on the left side you see examples of bridges. So we have small bridge, big bridge, it depends on the case. And we have veneer. A laminate veneer is a thin layer of porcelain or cast ceramic that is bonded to the facial surface of a tooth with resin. And on the right side you see example of veneer, usually made from ceramic or composite. Next type is removable prosthesis. I'm sorry, wait a second. I'm back, I'm sorry. So, removable prosthesis, removable partial dentures are made for patients who are missing some of their teeth on a particular arch, and complete denture, in other words, full denture, are worn by patients who are missing all their teeth in the arch. For instance, the maxillary upper or mandibular lower arch. And in the middle you see the simplest one, acrylic RPD, and on the right top also complete dentures made from acrylic resin. On the bottom on the right you see partial skeleton denture, and on the left side overdenture with precision attachments. So, dental prosthetic, what is it? What we do? So this is the one of the field of medicine that deals with specialized examination, prevention and treatment within the stomatognatic system. It works in the connection with laboratory technique having the same aim. The contemporary prosthetic is not only a method of inserting tooth, previously it was the main aim of the dental prosthetic. Now the definition involves also treatment and complete oral rehabilitation. So dental prosthesis must involve not only morphological reconstruction of destroyed tissue, but also functional rehabilitation of the whole stomatognatic system, taking into consideration like prophylaxis and favorable influence of the patient's psychic sphere. And rehabilitation of stomatognatic system, so the treatment of TMG disorders, traumatic occlusion syndrome, pathological dental abrasion, and oral parafunctions, prosthetic and orthodontic TMG treatment, functional disorders and malformations, post-operation and post-injured cases within the craniomaxillar complex, prosthetic treatment of periodontal diseases, prosthetic treatment of children and young people, prosthetic restoration of missing tooth on the base of the dental implants, so implantoprosthetic, and improvement of face aesthetic and patient psychic conditions. And the aim of prosthetic treatment is restoration of ineffective or destroyed function of the stomatognatic system, like masticatory apparatus, motor system, especially chewing ability and sounds articulation, which also elimination of oral parafunctions and motor system dysfunctions in connection with prevention against pathological state of tissues. Favorable influence on the patient's psychic sphere by the face aesthetic improvement. And this is definition, the aim of prosthetic treatment by our professor Stefan Majewski. And those aims can be reached by rebuilding of dental arches, continuity taking into consideration the correct occlusal surface configuration, rebuilding of correct mandible spatial position, vertical relation, horizontal relation, rebuilding of the normal occlusion, equal location of horizontal and vertical occlusion, forces to optimal number of teeth, additionally with horizontal occlusion forces reduction, the most harmful to periodontal tissues. Obtaining the force balance influencing the maxillary and mandibular parodontium. And those definitions are by Professor Stefan Włoch. Correct diagnosis is necessary for formulating appropriate treatment plan. So first of all, we need to examine patient, and then we need to establish the diagnosis and then formulate the correct treatment plan of each person. So, examination. In examination, we usually start from interview. So, personal data like age, occupation, general appearance of the patient, general well-being, medical history, past and present diseases like gastrointestinal and oral diseases, infection diseases, allergies, diabetes, dental history, especially which is related to the previous prosthetic experience, bad or good, patient's expectation also, and we can add economic situation in nowadays. What's more, medical history, like systemic disorders, chronic degenerative or dysfunctional diseases, hypertension, diabetes, anemia, vitamin or nutritional deficiencies, osteoporosis, chronic pulmonary diseases, Parkinsonism, salivary gland disorders, TMG disturbances, post-radiation therapy, fungal infection, menopausal changes, medication, history, diet, or habits. A complete oral examination should precede any treatment decision. So after interviewing, we can go to intraoral examination. So it should include a detailed examination of the teeth and surrounding tissue, and extraoral examination like OVD, TMG, radiographs, panoramic CBCT, LVG, etc. Vitality test of critical teeth, and evaluation of model mounted on an articulator. So on the first visit, we can also take some impressions, anatomic ones, and cast models from it and set in articulator to see how patients look like, because we can see it better than in patient's mouth. Yeah, and we have OVD, general appearance of the patient, TMG. So in the middle of this picture, we see that patient is with badly abrasion, and on the right you see that our OVD is too low, yeah, because we need to increase it. And establishment of intermaxillary relation, estimation of the vertical dimension, sometimes too low. So we see the equation RVD minus OVD is the perfect hour, the hour perfect occlusion height. Okay, we can go further. Construction bite. It restores a proper relation mandible to maxilla. And we have here wax bite and wax recording blocks. Sorry. So wax bite is when we need to focus only on the existing situation. So we don't change anything, but just take as it is. But in wax recording blocks, we can change the three-dimensional setting, range. So also we can estimate of TMG. So as you remember, it's temporomandibular joint, a disc in between them, and we have muscles inside. Sequence for oral examination, intraoral examination of both soft and hard tissues, accurate and complete charting of remaining teeth, number and location, condition of teeth, caries, evaluation of the pulp, electric, thermal testing, evaluation of sensitivity to percussion, existing restorations, accurate and complete charting of periodontal involvement like gingival inflammation, depth of periodontal pocket, degree of gingival recession, mobility of teeth due to the trauma from occlusion, inflammatory changes, post-alveolar bone support, the condition of the edentulous area like form or mucosa, shape of the vault, to plan type of major connector. Here we see periodontal disease, calculus, stains, gingival inflammation. What's more, soft and hard tissue abnormalities, occlusion of natural teeth like centric, eccentric, occlusal plane, supporting zones, and saliva. Yeah, we see soft tissue abnormalities on the bottom. We see lack of zone of supporting, yeah, when patient is in crossbite. And upper one also. Oral hygiene, bad oral hygiene. On the prosthesis, many calculus, many amount of stains. Yeah. And some symptoms of temporomandibular disorders like jaw sounds, like clicking, grinding, pain during movements, headache, facial pain, and deviation in movement. So it should be line of movement, should be straight. But in our temporomandibular disorders, this line is curve. Finally, radiographic evaluation. So we need to evaluate the caries, existing restoration, root canal filling, impacted teeth, root length, size and form, crown root ratio, lamina dura, periodontal ligament space also. The choice of abutment tooth. So what is important to choose it? Position of remaining teeth, tooth shape, crown to root ratio. So the root should be longer than crown, yeah, not reverse. The number of roots. So for example, molar, when we have 2 or 3 roots, is better than a small incisor when we have only 1. Tooth inclination, tooth mobility, load in occlusion, dental arch shape, edentulous alveolar ridge topography, acting forces direction, and denture type. The abutment tooth root area, acting forces, inclination of the tooth. So most of vertical forces are transmitted by the oblique fibers in the periodontal ligament. So as you see on the picture, right top. And when the tooth is tilted, this large group of fibers will not function effectively. So when mandibular molar is tilted mesially, bone is also resorbed on the mesial side because of forces acting here. So what are indications for fixed prosthodontics? 1 or 2 adjacent teeth are missing in the same arch. The supportive tissue are healthy. Suitable abutment teeth are present. The patient is in good health and wants to have the prosthesis placed, so motivation to treatment. The patient has the skills and motivation to maintain good oral hygiene. This is also very important, and patient can afford all the treatment. So what are contraindications? We say necessary supportive tissue are diseased or missing. Suitable abutment teeth are not present. The patient is in poor health. The patient is not motivated to have the prosthesis placed. The patient has poor oral hygiene habits, and the patient cannot afford the treatment costs. So those are indications and contraindications. Okay, and we go to the end of the presentation. So now I propose a break, and we are back about 7 p.m. o'clock, and then I will display you some video. So please don't log out, and we see after break. Thank you.